Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'll be your host for our program tonight on ear, nose, and throat problems. We will be glad to take your questions on hearing loss and ear, nose, and throat problems. The success of this program is very dependent on you, the viewer. Please call in your questions and we'll do our best to answer them. The telephone numbers for your questions can be found at the bottom of your screen. Our panelists this evening include Dr. Jonathan Glickstein, an ENT specialist with Essentia Health, and Dr. Jake Pernuski, a family physician with the Lake Superior Community Health Center in Duluth and faculty member in the Department of Family Medicine and Community Health at the Medical School Duluth. Our medical students answering phones tonight are Brian Berglund from Lauderdale, Minnesota, Travis Maverka from Glencoe, Minnesota, and Anna Stromberg of Black Duck, Minnesota. And now on to tonight's program on ENT problems. Well, Dr. Glickstein, welcome. Thank you for coming tonight.
Thank you.
We're looking at common things, and I think that one common thing is sinus infections this time of year. When should a patient see their physician for a sinus infection?
That's a good
question. Or sinus
question.
symptoms?
Sure, that's a good question because it's so common in this, probably the months from September to April, that people would have upper respiratory infections that are more significant than maybe other times of the year like the summer. I typically would say for people who have frequent sinusitis, if their symptoms persist longer than 2 weeks actually, that's kind of the cutoff point when patients would likely benefit from an antibiotic versus not. So if someone's symptoms have lasted 2 weeks or longer and they've tried things like using the neti pot with distilled or boiled water and using over-the-counter decongestants and using any other relief that, like a vaporizer that might help them. If they're having persistent symptoms such as facial pain, dental pain, purulent nasal discharge, that would be when I would seek care.
Well, I'm going to ask you a follow-up question right away then. What about the neti pot? Is that something that, is it work or is it?
I think it's somewhat controversial, but I think that the most important thing, of course, since some patients developed secondary infections from using regular tap water, it is important to use distilled water or boiled water when you're going to flush your nose with any device. And the main thing is trying to decontaminate the nose if there are infected secretions to allow the sinuses to drain more easily and more naturally. Also, we do know that the saline actually helps the microscopic hair fibers in our nose more effectively move the mucus blanket. And so I do think that it works, but perhaps not in the way that the manufacturers would tell us.
Interesting. Okay. Well, Dr. Pernuski, another common thing, kids and earaches. Okay, when do kids need antibiotics for earaches or ear infections, or what's the status of that?
Sure. A little bit depends on the age of the child. Really young kids, so say less than 6 months old, should probably see their doctor as soon as the parent has a concern for an ear infection or a concern that they're ill. Certainly kids less than 2 months. As kids get older than 6 months, it's reasonable to watch the child for a day or 2 or 3 and see how they're doing. I think one of the early things that parents can do at home to help their child are consider an over-the-counter pain reliever such as Tylenol, making sure that you're using doses as it recommends on the packaging. And if a child is getting worse or has symptoms that persist past 2 or 3 days despite those symptom control measures, it'd be reasonable to see their doctor. Many kids who have a sinus infection, many kids who have an ear infection, even if it's a bacterial infection, will get better with time. And antibiotics actually have some real risks with them. Kids can get complications of diarrhea or have allergic reactions to antibiotics. And so when it's not clear that the antibiotic's going to help every child with an ear infection, it is reasonable to see if their symptoms will get better with some simple care measures before trying antibiotics for most children.
Thank you. Dr. Glickstein, we have a caller wondering about hearing aids, caller from Duluth. Do hearing aids only amplify sound or do they actually help?
So I suppose that's sort of a couple point question. Certainly you can have the sort of low end amplifier, which basically has a microphone and then a speaker that just generically picks up sound and then turns up the volume. And you can purchase these, I think, for something like $100 or less, in a lot of different magazines. However, there are hearing aids which are certainly much more sophisticated, which can do things like amplify certain bandwidths. So if someone happens to have a particular bandwidth that they're not hearing well in, it can sort of amplify those sounds and not do so to some of the frequencies that may be normal. Also, the directionality of the microphone, because you don't want to amplify everything. So there are certain sort of sophisticated and high-end hearing aids that can do multiple things. But speaking with an audiologist, I think if you're interested in hearing aids, is probably the best way to go.
Dr. Pernuski, a caller from Duluth, wants to know about there's a patient has congestion and a cough, clear nasal discharge. Her right ear is plugged. So why does her right ear feel plugged?
I think it's really common when people have infections or allergies to have symptoms in multiple places. So inside of our head, the ear and the nose and the back of the mouth are all connected. It's just one space. And so if you have inflammation, either from allergy or from infection, it's not uncommon to feel symptoms in multiple places. One of the reasons for this is there's a tube that goes from our ear, from the inside of our ear to the back of our nose and throat. And if we have sinus congestion, that tube doesn't drain as well as it normally would, and so that translates to a pressure feeling or a fullness in the ear. Sometimes people will say it feels like they're underwater in that ear or muffled in that ear. It's a pretty common symptom. There are some things which can help. There are some over-the-counter decongestants which may help alleviate those symptoms in some patients.
Thank you. Dr. Glickstein, a caller from Duluth, this is another common one. What can you do to prevent bloody noses in the wintertime?
Excellent. Yeah, so one, the dryness, unfortunately, if you happen to have forced air heat in your workplace or at home, can dry and lower the relative humidity in your home. So a good target is around 50% relative humidity in your home, which could be achieved by having a humidifier in your bedroom, let's say, or depending on how dry your house is, if you have a wood-burning stove, maybe a pot of water by it or something to help improve the relative humidity. Also, there are commercially available saline gels. One brand is Air, spelled A-Y-R. I have no financial accommodations with them, but it actually is better than using Vaseline, which is a petroleum-based product, which tends to dry the nose.
So you put this in your nose?
So yeah, so it's a
at
topical
night
gel
or
that you
during the
put
day?
in. You can put in your nose, and it actually helps retain moisture. I find better than just a nasal spray, which is kind of here today and gone in 5 seconds. So that's
Interesting.
better.
Well, Dr. Pernuski, speaking of which, bloody noses, how do you stop them?
For most people, most of the time, the easiest way to stop the bloody nose is to just pinch the bleeding side against the middle of the nose. The nasal septum is the bone that runs down the middle, and if you take your finger and just push that side of the nose against it, that pressure will stop the bleeding. One of the most important things is hold the pressure for a long enough period of time. Oftentimes people hold pressure, let go to see if it's still bleeding, it starts bleeding again. So I actually recommend my patients hold the pressure for 5 minutes if they can, which seems like forever, but is often very effective in stopping the bleeding. If you have bleeding that goes on for a long time, maybe 45 minutes or an hour or more, that's not stopping despite the pressure, it is reasonable to consider going to an urgent care, an ER, or perhaps seeing your doctor. It could be a sign of something more complicated. And in those cases, sometimes we can do what's called packing the nose, actually putting stuffing, for lack of a better word, inside to help stop the bleeding.
So when you're pressing this, should you be sitting up or lying down?
I recommend just holding your head at a normal position. If you lean backwards, blood will tend to drain down your throat, and people don't like that. I mean, we sort of gag on it. It doesn't help. Leaning forward doesn't particularly help either. So I recommend just sitting at a comfortable position.
Thank you. Another question from a caller from Duluth. This person has had an abscess on her tonsil. What causes that? Is that something that needs to be addressed, or?
Well, an abscess on the or behind the tonsil, or a peritonsillar abscess, is actually more of an emergent or urgent situation. It's typically caused by bacterial infection in the throat and around the tonsil, and the germs become quite aggressive and elicit a very robust immune response. In that particular situation, you have pus trapped sort of inside the tonsil, and typically it needs to be drained. On occasion, if it's small enough, it can be treated with antibiotics or with steroid medication. It's more likely that someone's probably talking about, the caller might be talking about a cyst of some sort on the surface of the tonsil, which is fairly common. We see mucus retention cysts. They look yellow or white. But if there's any question of the diagnosis, certainly that needs to be confirmed either with family practice or possibly an ENT.
Dr. Prunuski, a question here regarding what causes postnasal drip, and what can we do about that one? Another common one.
Sure, there's actually several causes of postnasal drip. Postnasal drip is a description for our mucus, our snot, draining down into our mouth and throat, as opposed to us blowing it into the tissue or having it come out sort of the front side of our nose. It can be caused by sort of three things most commonly. Certainly infection, we talked about sinusitis earlier, can cause increased mucus and postnasal drip. But allergies, either environmental allergies or seasonal allergies, can cause increased mucus production and postnasal drip. And actually, sort of a less commonly thought of cause is irritation from other things. So sometimes people can have heartburn or acid reflux from the stomach, which can be undiagnosed. I mean, sometimes people can have what we call silent reflux. It happens at night while they're sleeping, so they don't notice it. And that acid is actually irritating to the passages, causing increased mucus and nasal secretions. So there's a number of different things which can cause postnasal drip. All of them can be treated and managed relatively straightforwardly if you can come to the right diagnosis and manage the underlying condition that's causing the postnasal drip.
Thank you. Dr. Glickstein, caller from Duluth wants to know about a perforated eardrum with no associated pain or drainage. Is that something serious?
There are lots of people who have chronic perforations of the eardrum. Sometimes it can be due to trauma, so maybe someone had a blunt blow to the side of their head, maybe a cupped hand or something like that, or maybe tubing behind a boat and fell on the water at a high speed, perforating the eardrum. However, usually traumatic perforations will heal. Of course, can't forget Q-tips, which you shouldn't use. But other people have had surgery in the past, let's say a tube placed in their ear to drain fluid or because of recurrent infections, and about 10% of the time you'll have a residual hole in the eardrum. To answer the question, a relatively small perforation in a patient who has had chronic ear problems is actually not a bad thing, as long as it's not causing substantial hearing loss or substantial risk of more infections because of water exposure. But I think the appropriate workup would certainly be to be seen by an ENT, to have an audiogram or hearing test performed, and then to go over the particular options, because not all perforations are created equally.
Thank you. I've got a kind of a two-part question here I'm going to ask, because there's several callers are wanting to know about sleep apnea. So, Dr. Prunuski, somebody comes in and wonders if they have sleep apnea. What kind of things would you look for?
Sure. So sleep apnea is a really common problem, or a common condition. Usually people wonder about it either because a partner is complaining about snoring in the evening, or because people are very tired during the day, falling asleep at important things like meetings or other activities. Sometimes doctors will become concerned about sleep apnea because a patient has high blood pressure, and sleep apnea and high blood pressure often go hand in hand. We can get a lot of information just by talking to the person who's concerned about it, asking about symptoms and sleep habits, and it can be examined for or looked for by doing a sleep study. And so essentially there are a number of ways to monitor people while they're sleeping to see whether or not they have apneic events or actually stop breathing while sleeping, which is what sleep apnea is.
And the follow-up part of this question is treatment of that. Is that a surgical treatment, or I know there are CPAP machines and things that are done?
Sure. So number one, if someone does have obstructive sleep apnea, it's important to figure out what the factors are that may be leading to it. Occasionally, and I find that's less common, there's maybe one reason for it, and if that reason could be fixed, then the sleep apnea would be gone. It's much more common, however, for it to be due to multiple issues. I think obesity or being overweight happens to be one of the most common associations. So really, in fact, the best treatment for it, other than usually wearing CPAP, would be increasing your exercise and losing weight. That's by far number one, I think. The gold standard currently for treating obstructive sleep apnea is going to be some sort of positive pressure or a face mask that either goes into the nose, covers the nose and the mouth. But there are, again, surgical options for some patients if they meet criteria for it.
Now, and I'll follow up one more last question. How about snoring without sleep apnea? Is that something that's treated surgically?
It can be, and if so, people are chronic mouth breathers and have obstruction in their nose from a deviated septum or enlarged structures called turbinates. These things can be corrected and improved so that people are less likely to mouth breathe and subsequently snore. Also, people who have an enlarged uvula, which is a structure in the back of the throat, as well as enlarged tonsils. If they have other symptoms and are such as tonsil infections, and they're interested in pursuing surgery for that, they could.
Okay, thank you.
I'd like to just follow up on sleep apnea a little bit. It actually is a fairly important condition, and sleep apnea and snoring aren't the same thing at all. And so if a patient's concerned about sleep apnea, they really should talk to their doctor to get evaluated. Snoring because of a congestion or a cold while you're sick isn't particularly harmful, but sleep apnea can be dangerous to your health in many ways and really should be evaluated. One of the common things I see in my practice that's associated with sleep apnea is actually the use of medications. And so medications that are sedating or make people tired sometimes can make sleep apnea worse. In particular, I think of some pain medicines and some medicines that help people relax in the evening. So I think there, as you mentioned, there's a lot of sort of complicated factors that can go into sleep apnea. And because sleep apnea can be dangerous for your health, it is important to get seen and evaluated.
Dr. Prunuski, here's a question. A caller from Duluth. What causes congestion in the lungs after eating? A person seems to cough a lot after eating.
One of the things that question makes me worry about is swallowing mechanics. And I worry in a person who has cough after eating that they've actually got what's called aspiration, or a problem where some of the things they're swallowing, rather than going through the food pipe into the stomach, are going through the air pipe into the lungs. And when we swallow things into our lungs find that very irritating. And the reaction of the lungs is a cough to try to get that material out of the lungs where it doesn't belong.
Thank you. Dr. Glickstein, there's a caller from Hayward wants me to ask you this question. The person has a pain above their eyes towards the top of the head, wonders if this is sinus related. How do you diagnose sinus problems? I guess would be the question.
Sure. So facial pain or discomfort is a very common concern, and often it's attributed to the sinuses when it very well may not be. I tend to find that it's more likely to be attributed to sinusitis than not, and more often it's not a sinus problem intrinsically. There are a couple of nerves that do run from about the eyebrow up towards the scalp in a vertical fashion. And so sometimes people who've had prior trauma, or people who have a headache condition called trigeminal neuralgia, for example, can have headaches. But probably the most common cause of forehead pain would be something like a tension headache, but typically people would describe that as more of a band or vice-like pain in the forehead. Certainly the way to rule in or rule out sinus disease as contributing to the headache would be an x-ray. So an x-ray
Or like
or
a plain X-ray or a CT or
depending on what the patient's story is and depending on how long it's been going on, that can be decided. A CAT scan is certainly more definitive but carries about 50 times the radiation of a plain film.
Sure.
So, but for me, a CAT scan, if a patient comes into my office, more commonly than not, if I'm even somewhat convinced it's sinusitis, I'll obtain a CAT scan of the sinuses. And if the CAT scan of the sinuses does not show any sinus disease, then we have to look for other reasons for that headache.
Thank you. Dr. Pernuski, a couple of questions here on tinnitus and ringing in the ears. What's that all about?
So ringing in the ears is common. Probably all of us get it to some degree. It is often associated with hearing loss, and in particular with high-frequency hearing loss. Part of the way our hearing system works is vibration of little hairs on the cells. And if those hairs are damaged or sheared or those cells are damaged, our brain gets confused and it perceives that injury as a ringing. It's really common with loud noise or trauma. So people who go to rock concerts, play in bands, have their iPod earphones turned up too loud, can cause sound-related damage to the ears, which will result in ringing.
Thank you. Dr. Glickstein, what is a cochlear implant and when is it used?
A cochlear implant is an electronic device that is surgically implanted into a patient's skull as well as into the cochlea, which is the inner ear. And the electrodes that are on the cochlear implant then directly stimulate what's called the spiral ganglion or the nerve that's connected to the brain. And it is typically only used in patients with bilateral or both ear profound deafness. In very certain situations in children, there's something called neuropathy where the nerve actually doesn't receive the messages from the ear correctly, and then a cochlear implant can be used. But cochlear implants are typically FDA approved for children 1 and over, and you have to have a certain amount of hearing loss in order to qualify for it. So it's much less common for that to be an indication for a patient than a regular conventional hearing aid.
Thank you. Dr. Pernuski, a caller from Duluth, I assume hit her head on a wall with rollerblades at the age of 4, and since then she can't really smell anything except peppermint.
So our sense of smell actually, there's a nerve that comes and ends in our nose, and if you get head trauma or trauma to that area, you can actually shear off those nerve endings, which can severely limit or in some cases even eliminate our sense of smell. Peppermint, probably she's sensitive to because it's a fairly strong, stimulus and may be able to detect. I'm happy to take anything.
Yeah, I think you should maybe even somewhat stimulating pain fibers, and so patients who have true anosmia or lack of sense of smell, alcohol or other solvents are sometimes perceived.
Okay. Thank you. We just have a little over a minute left. Dr. Glickstein, a caller about nasal polyps, are they common and how are they treated?
I would say in the general population they're not particularly common, although small cysts, for example, in sinuses are extremely common. Polyps are a result of inflammation in the sinuses and typically need a combination of both medical and surgical therapy if someone's nose is completely plugged by them.
Thank you. And one last question, Dr. Pernuski. Just a caller from Two Harbors wondering about, there's a cold going around the community. Is that head congestion, the usual stuff? When do you see your doctor about that?
I think the best thing to do is be good about washing your hands and keep your distance from other folks. In general, with cold symptoms, I recommend seeing your doctor if you have other health conditions like asthma or underlying breathing problems or immune system problems. If you're otherwise healthy, I'd say give it 10 days, 2 weeks, and if you're not getting better over that period of time, then it's reasonable to go see your doctor.
Thank you. A lot of great questions tonight. Well, I'd like to thank our panelists, Dr. Jonathan Glickstein and Dr. Jake Pernuski, and our medical students, Brian Berglund, Travis Maverka, and Anna Stromberg. Next week, please join Dr. Ray Christensen for a program on healthy living and seeking balance, when his panelists will be Dr. Dave Lear, Dr. Jake Pernuski, you're coming back again, excellent, and Dr. Dan Tomaszewski, who is a PharmD. Thank you for watching, and good night.